We're exploring hypospadias, one of the most common congenital conditions in boys. It's defined by an abnormal urethral opening, challenging surgeons for centuries. We'll trace the evolution of surgical techniques from early attempts to today's precision-based repairs. Join us as we meet the pioneers who transformed hypospadias treatment and improved countless young lives. In the late 1800s, Jacques-Louis Reverdin pioneered skin grafting, showing that transplanted skin could heal wounds. This breakthrough laid the foundation for reconstructive surgery, making complex repairs like those needed for hypospadias possible. Reverdin's work proved that skin could be moved and used to reconstruct defects, opening the door for future innovations. Surgeons Thiersch and Duplay introduced the first structured approach to hypospadias repair in the late 19th century. Their key innovation was tubularizing the urethral plate, rolling local tissue into a tube to create a new urethra. This concept became the blueprint for generations of surgeons to come. Sir Harold Gillies, a pioneer of plastic surgery, adapted wartime reconstructive techniques to hypospadias. He emphasized releasing curvature and using well-vascularized flaps, bringing artistry and sophistication to complex repairs. Gillies' principles of staged, meticulous reconstruction remain central to modern surgery. In the 1970s and 80s, Dr. John Duckett revolutionized repairs for severe hypospadias. He popularized the transverse preputial island flap, using foreskin with its blood supply to create a new urethra. This robust, vascularized tissue improved outcomes in complex cases. Duckett's work highlighted the importance of healthy tissue in reconstructive urology. Surgeons like Guercke and Schneck championed preserving the native urethral plate and minimizing dissection. Their approach reduced trauma and scarring, focusing on precise correction and tissue preservation. This philosophy influenced many modern refinements in hypospadias surgery. Dr. R.S. Asopa introduced buccal mucosa grafts, using cheek tissue for urethral reconstruction when local skin was insufficient. This resilient, easy-to-harvest tissue became vital for complex or redo surgeries. Asopa's two-stage technique offered hope for the most challenging cases. Buccal mucosa expanded the reconstructive options for surgeons worldwide. Dr. Mark Sendrin emphasized balancing function and appearance in hypospadias repair. He advocated for personalized surgical plans and standardized outcome measures. This patient-centered approach marked a mature stage in the field's evolution. In the 1990s, Dr. Warren Snodgrass introduced the tubularized incised plate tip repair. A simple midline incision allowed the urethral plate to be tubularized without tension, creating a natural-looking opening. The Snodgrass repair became the standard for many hypospadias cases due to its effectiveness and reproducibility. This innovation transformed outcomes for countless patients. Dr. Ahmed Hadidi developed hybrid techniques for the most severe hypospadias cases. By combining tip principles with flaps or grafts, he tailored repairs to each patient's anatomy. Hadidi's meticulous, individualized approach exemplifies modern surgical refinement. Surgeons like Dr. Lisandro Pagliere and Dr. Fernando Gonzalez refined glandsplasty, focusing on a natural conical glands and slit-like meatus. Their meticulous techniques improved both appearance and function. Attention to these details reflects the field's commitment to psychological and aesthetic outcomes. Recent years have seen a shift toward holistic, evidence-based care. Leaders like Dr. Nicole Bush and Dr. Ricardo Gonzalez champion standardized outcome measures and long-term follow-up. Family-centered care, shared decision-making, and ongoing support are now central to hypospadias management. This ensures that surgical advances translate into better lives for patients and families. The story of hypospadias surgery is one of relentless progress and hope. From early skin grafts to today's personalized, precise techniques, each advance builds on the last. Ongoing research and collaboration promise even better outcomes for future generations. Thanks for joining this journey through the remarkable evolution of hypospadias care. Best regards, Dr. Mohammed Mare.